medications. So having said about you can with these equipments you will be able to diagnose some lesions. Okay, so now we'll see some medications also. So the general principles are identify and remove any irritating factors, foreign bodies, discharge, miss the hairs directing into the cornea. So all these things you have to remove. Ensure optimal nutritional status of the patient. So this I have seen when the case is presented with bilateral problems. Necessarily assess the nutritional status, do a hematology test, and then check whether all the parameters are normal. Then start proceeding with the treatment of the eye. Trim the hair around the eyes. Then your initial choice of antimicrobials replaced later, you can choose, and later you can replace it with the ABST. Then address to ciliary muscle spasms also, because there will be pain. So these are some certain basic things you should keep in your mind. And when you use drugs into the eye, first you will be putting it in the conjunctival sac. This is topical medications, or you can also go for subconjunctival injections. You can also go for retrobulbar and intraocular. This is a little rarely practiced, but you can use intraocular also, especially surgeons can use. So these are the various sites of drug administration. For example, if you have drops, drop trainers, ointments, it is into the conjunctival cul-de-sac. Subconjunctival, you need a needle or a cannula, then into the intravitreal, then retrobulbar or periocular injections. So all topically applied ointment suspensions, they are absorbed through the cornea and conjunctiva, but they do not penetrate the cornea. So it is not good for intraocular diseases. It is used only for the topical. And penetration to the posterior segment is extremely limited. So you are not supposed to use. If you suspect a posterior uveitis, don't stop your treatment with the topical drops alone. Subconjunctival injections, they facilitate again the transfer of medicines up to the anterior chamber, but it is because don't think that because you are given an injection it enters throughout the eye. It is not so. It just gives only a depot effect. And intraocular injections like intracameral and intravitreal injections into the eye, actually you need to anesthetize the patient, then only you can proceed. So that is why following surgery intraocularly we give some antibiotics inside the eye. We also give some anesthetics into the eye to get a good post-operative analgesia. Systemically administered. So this is not commonly used because you have to generally give an anesthesia and then inject the drug into the eye. Then systemically administered drugs, oral and parenteral, they reach all vascular ocular structures, but they are not delivered in useful concentration into the avascular structures like cornea and the lens. You should always think about this important point. So penetration into the cornea and lens happens only again through the topical. That is why we combine all these types of treatment. So intraocular penetration of systemically administered drugs can happen when there is a breakdown of the blood ocular barriers. And also to increase this for the drug to penetrate through the cornea, the lipophilicity of the drug is also increased. So into the conjunctival sac, whenever you put a drop, we normally ask them to put the drops, but you have to necessarily tell them that you remove the purulent exudate and all from the conjunctival sac. You can either use a distilled water or a normal saline. 10% acetylcysteine also can be used. So a drop can be instilled from 2 to 3 centimeters from above, and ointments also can be should be melted at body heat. So you can keep the ointment in your palm, and then so that it will with the body heat it will come out little not as a very hard ointment. So you can take 1 centimeter of a ribbon from the ointment from the tip, and then you can apply it over the cornea. Then avoid touching the hairs around the eye with the tip of the irrigation or drop bottle, and should not be used for more than 1 month after opening the vial. So recently I have published an article in the Kennel Club of India. So with actually you can go through that. I will try to provide the QR code for that. So where I have described how to put the drops and what are the precautions you should take while putting drops into the eye. Subconjunctival injections, you should never give more than 1 ml. If at all required, you have to give it at different sites. And good absorption and relatively long duration is one advantage. And this is used only when there is absolute necessity. For example, if the conjunctiva is very not inflamed, only you are supposed to give a subconjunctival injection. If in an inflamed conjunctiva, never administer any subconjunctival injection. And sometimes you can use a cannula, or you can also if you are very careful, you can use a hypodermic needle also. So normally we put a topical anesthesia with the proparacaine and then give the subconjunctival injection. So intraocular injections are again into the anterior chamber or into the vitreous. Almost this is done as a last resort. In case of panophthalmia, you can treat. You can also flush the anterior chamber and then you can administer the medicine. Intraocular gentamicin injection is given as a last resort, so that once you give gentamicin injection, it results in iridocyclitis. Thereby, it causes the reduction of the production of the aqueous humor from the ciliary body and thus lowers the IOP. So done as a treatment for end-stage glaucoma where there is no vision. So ocular therapeutic agents can be classified as vasoconstrictors, antihistamines, local anesthetics, antimicrobial agents, corticosteroids, non-steroidal anti-inflammatory drugs, anti-glaucoma agents, mydriatics, vitamins and epithelializing agents and neutral agents, and chloria. So in this, the vasoconstrictors are epinephrine or adrenaline, which you can use it for mainly to arrest hemorrhage. It can be also used as a to dilate the eye, especially as a palliative agent in Horner syndrome into the affected myotic eye. And also it can be used as an intraocular mydriatic while doing cataract surgery. Phenylephrine also can be used, but I have not used phenylephrine because adrenaline is available. But one thing you should understand here is whenever you use adrenaline intraocularly, you should use only the adrenaline which is not having any preservative. Some adrenaline has got sodium bisulfite preservative, so you are not supposed to use it inside the eye. Antihistamines are very commonly used in case of human ophthalmology, but it is not we have not seen a good placement in veterinary ophthalmology. But very rarely we use that also. We use olapatidine hydrochloride 0.1%, andazolene 0.5%, and nafazoline are used very commonly in case of human beings. So most of the time they will be replaced with the corticosteroids. So that is why we don't use. But necessarily you should understand one thing: whenever there is in conjunctiva, when there is swelling, the swelling is mainly due to the presence of the mast cells. So mast cells produce histamines. So this release of histamines causes the edema. So to stabilize the mast cells, you need antihistamines like olapatidine. It is effective in dog in allergic conjunctivitis, but its effect on cat is not that clear. Local anesthetics like topical, intracameral, and regional block are there. So topical is mainly with the proparacaine. Intracameral we normally give for the to alleviate pain, and regional block is mainly to effect good post-operative analgesia and also to perform some surgeries in the eye. Then it is topical administration is again achieved mainly with the help of the cornea. So how will you know that it is the effect has happened? It is by assessing the corneal sensitivity. So we were talking about in the last few slides how to assess the corneal sensitivity. So prior to administration of the local anesthetic, you assess the sensitivity. Then after application of the topical anesthetic also you assess, and if you are happy that the corneal sensitivity is abolished, then you can work further. So this is useful for procedures like tonometry, corneal and conjunctival scrapings, not for swabs. Okay. Foreign body and corneal suture removal, gonioscopy, nasolacrimal canalicular manipulations, and intracameral injections. So STT test done after this is called STT2, and this is also used intraoperatively to increase the corneal analgesia. So proparacaine is commonly used. It is available as 0.5% solution and very widely used topical anesthetic. And the advantage is it does not penetrate the cornea and conjunctiva, so it will be there on the surface only, and it won't produce any discomfort to the patient. There is no irritation. And in dog you have up to 45 minutes, in cat 25 minutes, and in rabbit it is 63 minutes. So that is what they have studied. And intracameral application of local anesthetics, that is lidocaine and bupivacaine, that is why this preservative free lidocaine and bupivacaine can be used intracamerally to prolong the analgesic effect, especially after cataract surgery and also phacoemulsification procedures. Regional injection to achieve eyelid agnesia auriculopalpebral nerve block mainly we can perform with the help of lidocaine. There is a routine 2% can be used, and lignocaine 4% also can be used for surface anesthesia like proparacaine, but effect is less. To achieve local analgesia through local infiltration, line block, then akinesia and analgesia through peribulbar and retrobulbar injection, and also subtenance anesthesia is also very effective method to produce with the use of a regional injection. Retrobulbar and peribulbar block, one important advantage is it abolishes the oculocardiac reflex. So that is one. That is why it is sometimes used as an adjunct along with other general anesthesia procedures, so that you can prevent an oculocardiac reflex while doing an intraocular surgery. Antimicrobial agents are commonly used. You can use the for first few days, and if you are not getting an improvement, necessarily you should do a sensitivity test and then proceed for the antibiotics. So antibacterials, it is actually initial choice of antibacterials. You can choose starting from quinolone derivatives like catafloxacin or moxifloxacin, etc. Then if it is against gram negative, then you have to accordingly do a sensitivity test and look for the choose the antibiotic. So chloramphenicol is a commonly used antibiotic, and its ointment and drops are also available. It is a bacteriostatic and not bactericidal, and it is almost low pathogenic eye infections you can use chloramphenicol, and conjunctivitis, keratitis, uveitis and all you can use. And I prefer to use chloramphenicol opticaps in case of KCS also, because it gives a lubrication effect also at the same time. And sometimes you find hypersensitivity, but one thing you should remember, in case of human beings, it can cause aplastic anemia, constant use. So generally we used to tell them, because these days they read through Google, everything. So we used to tell them that after use on the eye, carefully they can wash their hands. It is not reported in polymyxin. So all these can be used. You can also get a combination of this to work on the various gram positive and gram negative organisms. But this is not effective against Pseudomonas species. Specific choice of antimicrobials are also there. Povidone 0.1% drops can be used mainly to for conjunctivitis, and also it is used mainly for as a preoperative use also, the 5% solution. There is some side effect we have seen when we use povidone at a higher concentration. So you will, because of the histamine reaction, you will find some local irritation. So in case of lid surgeries also, you can use povidone, but always see that after using povidone, you use again sodium chloride or distilled water to clean the eye. Then framycetin 0.5% drops as for a neomycin can be also used against Pseudomonas species. Then gentamicin drops like aminoglycosides also can be used as 0.3% drops as neomycin for a Pseudomonas species. Chlortetracycline 1% and oxytetracycline 0.5% also can be used as against Mycoplasma species and Chlamydia species. Then tobramycin, then norfloxacin. So all quinolone derivatives also can be used as a broad spectrum antibiotic for lytic corneal ulcers. Sometimes we combine preparations. Sometimes when we do the antibiotic sensitivity test, what happens is you will not get a proper drug that is present in the market. So you may have to make some antibiotic eye drops from the injection forms, like from cefazolin or amikacin, etc. If it is sensitive to amikacin, you can prepare. There is a fortified antibiotic eye drop chart. With the help of that, you can prepare the antibiotics from the injection forms and then administer. Only thing is, when you prepare this in the clinic, you have to take very extra careful, and you can dilute these medicines in the artificial tears and then give. And they can use it for maximum period of 1 week, and then you have to prepare again, freshly prepared ones you have to give. Then antimycotics. So mycotic infections are very less in dogs, but if at all you get, you can use natamycin 5%. Amphotericin, I prefer to use miconazole as a common antimycotic drug. Povidone also can be used as a antimycotic drug against mycosis and yeast. Antiviral drugs, acyclovir 3% is commonly used as against the herpes infection, and also we use famciclovir 30 milligram tablets So these two are very effective in case of cat. So herpes infection is very common in case of cats. So wherein you can use all these drugs. Then anti-glaucoma agents, mitotic agents are commonly preferred, which will facilitate drainage of the aqueous. But definitely we don't use much of pilocarpine in the treatment of the medical treatment of glaucoma in veterinary ophthalmology. So we mainly depend upon carbonic anhydrase inhibitors, which will reduce the production of the aqueous humor, and prostaglandin agonist. So that topical prostaglandin. So they basically open up the uveoscleral outflow, and it will help in the drainage of the aqueous humor. So these are the two things we normally use. The use of miotics in animals are actually restricted to the displaced lenses. When the lens is displaced, so you have to necessarily use a miotic agent so that the lens will be there in the posterior chamber. But whenever you find lenses luxated, you have to, it has to be removed surgically. Hence, miotic agents are not very commonly used. And carbonic anhydrase inhibitors, acetazolamide, can be used, but you should always worry about the potassium status of the animal. You have to supplement it. And dorzolamide, so when you give tablets, but dorzolamide drops are very safe, and brinzolamide drops are also there, which is not proven much effect in the cat, but it is less irritating to the cornea than the dorzolamide. Dorzolamide drops, when you use very frequently for a period of 3-5 years, sometimes it can cause corneal ulcerations. Then osmotic agents, if you want to immediately reduce the intraocular pressure, for example, the patient is brought fixed for a cataract surgery, and if you find that there is a pressure rise, immediately with the help of osmotic agents, you can reduce the intraocular pressure with the help of mannitol 20% and also glycerol 0.1 to 0.6 ml orally. So normally we depend upon mannitol, which will be given at the rate of 1 to 5 ml per kg for a period of 24 hours. So very slowly you have to give. And if at all, if the pressure is there, we normally give mannitol in the morning hours and do the surgery in the late evening hours. Beta blockers are also finding a place in the glaucoma treatment, but my personal experience is you should use this very carefully. Whenever you start administering the beta blockers timolol, you think it is only a topical drop, but there is systemic absorption. Much of systemic absorption is there into the vascular side, and hence you should be very careful. So always take a X-ray of the chest and rule out any pathologies on the heart, and then you prescribe timolol or any beta blockers. Betaxolol is, the effect is less when compared to timolol, and it is more safer to use rather. So we prefer latanoprost 0.025 to 0.005%, and 1 to 2 times daily can be given, or at the evening. So this is a very powerful. When you give latanoprost, what happens? Immediately meiosis happens, and you can also see the difference in this eyeball size also. So immediately you will find a shrinking of the eyeball, and the owners also will be very happy because the pain will be reduced for the pet. So latanoprost is a very safe medicine which you can use, and as an anti-glaucoma drugs. But there are some side effects where, like I have seen as an iris pigmentation as one of the side effects. Punctate keratitis, if you can, whenever you give latanoprost, always try to give the artificial tears also in its place very commonly, so that you can prevent keratitic precipitates on the cornea. Mydriatics find a place in the eye treatment. Not many people are using corneal for corneal ulcers, that is to prevent the cycloplegia, and also to without perforation of the iris into the through the corneal ulcer, and as a part of treatment of uveitis. But generally, I don't prefer atropine because it causes the reduces the secretion on the. It will patient will be more prone for KCS. So that is why it is contraindicated for glaucoma and KCS. What happens in glaucoma when you give atropine? The dilatation of the eye closes all the drainage angle, and it will in fact increase the pressure in the eye. So opposite of latanoprost rather. So it profuse salivation, all things are very common in cats. So always when you use even tropicamide, when you use, you should inform them that there will be salivation and you don't have to worry about it. Corticosteroids are the major mainstay of treatment in the eye, and they are membrane stabilizing effect and inhibiting effect are very prominent with regard to the inflammatory reactions and also to the epithelialization of the cornea. So that will affect. That is why you should be very careful when you use corticosteroids topically. And inflammatory reactions such as allergy, conjunctivitis, keratitis, and if there is some granulations, uveitis. So all these things you can use corticosteroids. Postoperatively against corneal vascularization, that's what I said, against corneal vascularization. So you should look for vascularization, and accordingly you have to titrate whether to use corticosteroid in your prescription or not. Then the edema, fibrin formation in the anterior chamber, you definitely depend upon corticosteroids. Contraindications are the epithelial lesions. So that is why always we do fluorescein test prior to the administration of corticosteroids. So nowadays corticosteroids are available along with antibiotics. So administration of the medicines, antibiotic ones, then corticosteroids again, so they can avoid. So if you have combined preparations, so ease of installation of the drops is easier for the pet owners. Prostaglandin synthesis inhibitors are the NSAIDs. Carprofen, ketoprofen, meloxicam are there. Flunicin, meglumine is something which very commonly we use in horses, and especially traumatic and non-traumatic uveitis. Non-steroidal anti-inflammatory drugs, I don't find as a very important stay, because you have now soft corticosteroids. It is not corticosteroids like a glucocorticosteroids you have to use. You have soft corticosteroids like lotepretol you can use for the in place of the NSAIDs. If at all I use NSAIDs, it will be flurbiprofen, which will be given in case of a low-grade uveitis prior to cataract surgery. So flurbiprofen is 0.03% available as 2 to 4 times. You can give against uveitis. Ketorolac and diclofenac are also available in the market. Vitamins, epithelializing agents and neutral agents are also there. So vitamin A actually supports epithelialization. So you also have nowadays gel. So you can apply the gel directly topically on the eye, and also it is used in KCS and retinal rod degeneration causing vitamin A deficiency. So because of vitamin A deficiency, so there also you can supplement with the vitamin A. Vitamin C tablets are also very important. As I said about presence of vitamin C in the anterior chamber and in the vitreous chamber is very important for the health of all the structures within the eye. So vitamin C supplementation is also very important, and it is important for the corneal cement substance also, mainly for the stroma. Then B1, riboflavin, B1 is very important. In cats, they say diets containing large amount of fish. So you will sometimes find even protrusion of the nictitans as a common phenomena because of fight. And so here you can administer vitamin B1, riboflavin, to the animal per dose for a period of 10 to 15 days. And also vitamin B1 can be used in the case of Horner syndrome also. Vitamin E tablets 5 to 10 milligram per day per orally also can be given to prevent retinopathies. So nowadays you have a combination of all these tablets, all these vitamins, and in a single tablet with zinc and other important minerals required for the health of the retina. Artificial tears, you can never work any treatment in the eye without the prescription carrying an artificial tear and as well as ointment. So you have artificial tears like gel, drops and gel are also available, mainly hydroxypropyl methyl cellulose. So they are employed in the treatment of KCS, They are a good vehicle to increase duration of action of other pharmaceuticals on the eyeball also. So normally we prescribe, when you prescribe oxyfloxacin, what we normally used to tell is they have to put eye drops first, like hydroxypropyl methyl cellulose, wait for 15 minutes, then instill the antibiotic. So the penetration will be better. Then you also have artificial tears like hyprolose. So that is about rods that are introduced into the ventral conjunctival sac, and they dissolve and they cause less irritation, suppress the irritation. But we are not commonly using all these. They are all treatment for the KCS. Coleria is some terminology which you have, I think, forgotten in the ophthalmology. So you have zinc sulfate as 0.1 percentage. Sodium chloride can be used, and you can also use distilled water as a coleria. Earlier in our student period, we were using boric acid solution, 1 to 3% as a coleria. We used to prepare the solution and use it on the cornea as an eye wash. So that is called a coleria. And nowadays you have types of when I talked about coleria, it is a sodium chloride is very 0.9% is very commonly used. People who are wearing contact lenses, so they keep their contact lenses in the preparation. So they normally give along with it. It's nothing but sodium chloride 0.1% isotonic solution. So that also can be used whenever you use a lens. The lens, artificial lenses are stored in again in a coleria medium only. So that once you open the sac packet, you will be able to see that solution inside the eye. So they are all good coleria that are all safe for the cornea. Povidone again, buffered povidone can be used as a coleria, but further irrigation with 0.9% sodium chloride is always indicated, or I use distilled water after that. Then it is again very important to use povidone for with the infections with the purulent conjunctivitis. So whenever there is purulent conjunctivitis, just cleaning with the distilled water alone is not sufficient. And EDTA 1 to 2% solutions also can be used against salivary crystals on the cornea after parotid duct transposition. But we normally never do this procedure as a common thing because it is a very tough, technically demanding procedure, and the desired effect after doing a technically demanding procedure is also less in a KCS cases. So with all these mechanisms, with various treatment diagnostic procedures, you will be able to diagnose many of the problems that are brought to your clinic, and so extraocular or intraocular. So all these, sometimes some are considered as emergencies. So all these you will be able to diagnose well now with the help of these equipments, if you can have a proficiency in using this. So this following is the list of problems or situations in which the general practitioner should consider while referring the case to the ophthalmologist. Early evidence of cataracts. You should have it is a technically highly demanding surgery. Phacoemulsification needs a high learning curve, and any suspicion on glaucoma, deep or non-healing corneal ulcers, blindness, partial or complete, because it is an alarming thing for the owner also. Anything involving intraocular surgery or anything confusing about ocular exam or ocular problem, immediately you can refer, or if at all you are able to diagnose, but if you lack the appropriate instruments or diagnostics, you have to refer to a veterinary ophthalmologist. These are various visitors who came to our ward, and then also we conducted the ophthalmology meet, and this is a free animal eye camp which we conducted in our institution, and you can see all our mentors there in that picture, starting from Dr. Simon Peterson and also Dr. Radhakrishnan sir, and also other staff of the universities. So thank you very much. So with the help of all this gross examination, that is, should have a good emetropia, that is what I meant, and equipment dependent exam with the magnification, zoom, you can actually, with a good illumination, you can improve your knowledge and do a comprehensive ocular study with, of course, with a good documentation. Always refer the format and then try to complete it and then proceed. Your examination procedures will be easier. This is my niece examining. So they can always examine the other friend's eye. That is how you to get familiarized with the equipment. But one advice is never try to dilate the eye and then do the exams. Okay, just to do with your illumination available in the equipment. Thank you very much.